All right, and we're back with the treatment for peripheral nerve entrapment. So we've got Seb lying obviously face up. For those of you therapists, obviously that's supine, not prone. So what I'm going to do here first, as I mentioned with the assessment before, my first port of call for these peripheral nerve entrapments is obviously going to be the neck. Now you'll probably see some abrasions here on um, Seb's neck. That's not from me, okay? That's from his jiu-jitsu and choking and God knows, is that your gi up against there? Right, okay. So that's not me, all right? Not me at all. Now, in terms of creams or oil, obviously I don't use oils, but I'm using a Premax Original. Now, the reason I'm mentioning that because this particular cream is really quite sticky. So where I'm working short areas and I want to make good changes, I don't want something too slippery. I'm going to use something that's got a little bit of grip in it. And Premax Original is awesome for that. In fact, for most of this treatment, I'm going to, well, actually all of it, I'm going to be using the original. But find yourself a cream that's got a grippy sensation, not too slippery, okay? And it's also really important that when you apply your cream, that you don't put too much on. So sort of put too little on, and then you can always add to it as opposed to the opposite way around. So I'm just going to put a little bit on there. Obviously, I've worked on Seb heaps of times, so I know what his skin's like. I know much how I can put on. And then, I've got the right medium that I can work with. Right, so we're going to be looking at this scalene's area first. So for most of you, if any of you have seen my master classes, especially on muscle tension headaches or even cervicomandibular dysfunction, you'll know that obviously the SCM is our main landmark. So we can pick up our SCM there. What we're going to do is we're going to dive underneath that basically the posterior border of the SCM, and that's where we'll find the anterior scalene. Okay, so I'm going to work. So how do we address this? So push it up, take a little bit into rotation. Okay, so away, and then I'm going to move him back over into rotation because I want the tissues to soften off as I work into that rotation. So you don't need a lot of pressure onto these, okay, because you've got a bony background of being the spine. So you're just going to push up against there. You should be nowhere near any blood vessels or any dangerous structures. So we bring him right over, and then I sink in as far as I can as I take him into rotation. So it's really just a slow, passive release type technique, okay? So you're much better